Hi, Assalamualaikum. I am Fatiha. In this video presentation, I will share about echolalia. So, let's get started. First of all, I will start with the definition. So, echolalia is the immediate or delayed repetition of previously heard speech from songs, TV shows, movies, or communication partners, and is frequently produced by individuals with autism. Echolalia is a normal part of speech and language development. It improves over the first 2 years of life. Pathological echolalia persists beyond the age of 3 years old. As language skills develop, echolalia tends to become less prominent. If automatic speech imitation persists or re-emerge past the age of 3 years, one may begin to suspect a speech developmental delay. There are two types of echolalia. Firstly, immediate echolalia, and secondly, delayed echolalia. For immediate echolalia, it occurs immediately when an individual instantly repeats speech of another individual. As for delayed echolalia, it occurs later when an individual repeats another speech after some time. It can happen for hours, days, months, or even years later. Both of echolalia can be either interactive or non-interactive, which means the repeated phrases that they produce were meaningful for communication purpose or no clear communication purpose. These are the example of echolalia. As for simple echolalia, another person asks, "Do you want cake?" They will answer, "Cake, cake, cake." As for complex echolalia, another person will ask, "Do you want cake?" They will answer, "Cake is a form of sweet dessert and best stored in airtight container," which they heard from TV advertisement. So why echolalia happen? It could be for a stimming behavior. This is because it feels good to repeat those words. Stimming is any self-stimulatory act and it can use for stress relief. It can help focus and calm. Another reason may be OCD, which is obsessive compulsive disorder. In OCD, the person may repeat the words because they're afraid something happening and feel a lot of shame as a result. They may do it because they think they are preventing harm and protecting those they care about. It could also be due to sensory overload, such as being close to shutdown or meltdown, and this can be because of their sense of pain, temperature, touch, ta- taste, smell, sight, balance, body awareness, and digestion. It can also be due to learning because every person during their development repeats words in order to get a grasp for how they feel. Or it could be because the autistic person doesn't actually understand what is being said, or maybe they just understand a part of it. So they are repeating something related to it, meaning that they have some kind of understanding, but not a full understanding.
Our brain has a certain limit on the amount of information it can process at one time. A typical brain selectively focuses on some aspects of the surroundings and ignores others, keeping sensory input at a manageable level. An autistic brain, on the other hand, seems to absorb all information more or less equally, or in some cases, fixates on a different object or subject. As a result, autistic people may notice details that others do not, but have difficulty following the topic of a conversation or seeing other people's point of view. They may take in more information than their brain can handle and become overwhelmed. This causes stress and may affect the ability of the brain to process the information properly, resulting in a delayed response or no response at all.
There are some treatments that can help to reduce echolalia in autism children. Firstly, speech therapy. A speech language pathologist play an important role in treating echolalia in childhood autism. ABA seeks to understand the reason for speech repetition and respond in a way that helps the child learn appropriate communication skills, which include cues pause point training, script training, visual cues, just stop learning, verbal modeling, self monitoring training, differential reinforcement of lower risks of behavior, and positive reinforcement for appropriate responses. Second treatment is pharmacotherapy, where medication may be indicated to older children where the echolalia is triggered by stress and anxiety. The example of medication is clomipramine and fluoxetine. And lastly, at-home treatment, where we can do it continuously. And there are some strategies to reduce the echolalia. When communicating with the child, try using simple words and sentences that they can comprehend. Do not repeat the sentence and wait for the children to process what we have said. Children tend to use echolalia when they do not know how to respond or have trouble turning their thoughts into words. To help them, we can provide a script. For instance, ask the child what is our cat name and reply Bob. Repeat this until the child has learned the right script. Using visual support is an important step of the strategy. Use a book that has pictures showing the language and have the child look directly at what is happening in the book. For example, while looking at the book, say this is an apple and point it at the picture. You can even take their finger and put it at the apple and say this is an apple. Repeat until the child gives the correct response. When talking with the child, do not ask them a question. Instead, give them a choice. Instead of asking them, try holding each item forward when offering the choices. For example, do you want an apple or a banana? Be sure to model the names without the question tone at the end. Another strategy to reduce echolalia is to model with a partner. Ask another person, he may be another family member or a sibling, the question and have them respond. For example, Sarah, what would you like to eat? Sarah will respond, I want a banana. Try this a few times in front of the child. Then ask the child what they want to eat. So that's some of the information that we can learn for echolalia. That is all from me and thank you for listening.